Good morning, wherever you are. This is Nova Quinn from ConferenceHype. Our segment will focus on IGH, FENDRR, and specific KRAS mutations define a novel B, all-molecular subtype with poor chemotherapy response. From the 2026 August 18 edition of Blood. Background: Eltrombopag combined with horse antithymocyte globulin and cyclosporin A is the standard of care for patients with severe aplastic anemia who are not eligible for stem cell transplantation. Methods: the Eltrombopag for MAA trial is an investigator-initiated, prospective, randomized, placebo-controlled, double-blind, multicenter, Phase 3 trial and compared Eltrombopag plus CSA with placebo plus CSA as a first-line therapy for MAA patients with clinically significant cytopenia. Results: in patients with evaluable response at week 24, the overall response rate, including partial response and complete response, was significantly higher in the Eltrombopag plus CSA arm than in the placebo plus CSA arm. Discussion: the trial was registered as NCT 027732225 and at European Union Drug Regulating Authorities clinical trials as UDRA CT 2014-000-174-19. From the 2026 August 11 edition of Blood. Background: while the FLT3 inhibitor gilteritinib is initially effective in patients with FLT3 mutated acute myeloid leukemia, patients invariably relapse within months of treatment. Methods: gilteritinib resistance is commonly driven by the emergence of NRAS mutations and a shift towards a more monocytic cell state. Results: we hypothesized that directly targeting and depleting NRAS protein would reverse these adaptive differentiation changes and restore therapeutic sensitivity. Discussion: resistant cells were resensitized to venetoclax after NRAS knockdown, suggesting that NRAS knockdown may be more broadly applicable in overcoming monocytic cell state and drug resistance in AML. From the 2026 August 20 edition of Blood. Background: despite immunosensitivity, genetic heterogeneity, low mutational burden, and lack of tumor-specific antigens hinder immunotherapy success for acute myeloid leukemia. Methods: T-cell receptors offer a promising route by targeting tumor-relevant extracellular and intracellular antigens shared across AML subtypes. However, HLA restriction limits their potential. Results: we identified a potent TCR capable of recognizing peptides of cathepsin G, a serine protease confined to neutrophil granules but aberrantly localized in the cytoplasm of blasts, when presented by HLA-A and HLA-C*0702 highly frequent alleles. Discussion: these results reveal the potential of dual-restricted TCRs and of CTS-GDCR T cells as powerful therapeutics for a broad population of patients with AML. From the 2026 August 18 edition of Blood. Background: hematopoietic stem cell transplantation is a curative intent treatment for otherwise lethal hematological malignancies. Methods: the first 100 days post-transplant is a period of high risk for opportunistic infections, including reactivation of latent viruses, as the recipient's immune system reconstitutes. Results: at the initial detection of HCMV reactivation, patients who went on to experience high-level HCMV DNemia had lower CD45 RO plus CD27 CD8 plus T cell, and greater CD57 plus V delta depose gamma delta T, and TIM3 plus CD4 CD8 plus MAIT cell compartments than those with controlled infection. Discussion: we propose these cell subsets as predictive biomarkers for HCMV reactivation post-HSCT to inform clinical decision-making. From the 2026 August 11 edition of Blood. Background: dysbiosis after allogeneic hematopoietic stem cell transplant predisposes to acute gastrointestinal graft-versus-host disease. Methods: human milk oligosaccharides are prebiotics that establish a favorable intestinal microbiome. Results: generalized linear mixed model analysis revealed higher association of bifidobacteria and blosha with 2-FL. Discussion: 2-FL is safe and modifies the gut microbiome in children following allo-HSCT. From the 2026 August 20 edition of Blood. Background: hematopoietic stem and progenitor cell development requires finely tuned gene expression programs, yet the role of transfer RNA modifications in this process remains largely unknown. Methods: in this study, we uncover the essential function of the tRNA methyltransferase, TRMT61A, in sustaining fetal liver HSPCs through N1-methyladenosine deposition. Results: ribosome profiling revealed globally declined translation efficiency because of translational blockage upon TRMT61A loss in HSPCs, notably of the transferrin receptor. Discussion: our work elucidates an epitranscriptomic pathway, the TRMT61AM1 ATFRC axis, that safeguards HSPC integrity by linking tRNA modification to iron homeostasis and preventing DNA damage, providing mechanistic and therapeutic insights into hematopoietic disorders. From the 2026 August 18 edition of Blood. Background: endothelial cells rapidly alter their phenotype to support hemostasis and inflammation through the exocytosis of specialized storage organelles, known as Weibel pallid bodies. Methods: this exocytic response is stimulated by a variety of physiological and pathological triggers, which act through well-described transmembrane receptors. Results, however, the influence of mechanical forces and how this shapes this fundamental endothelial response remains relatively unexplored. Discussion: together these data reveal a previously unrecognized instigator of WPB exocytosis and a mechanosensitive molecular pathway coupling inflammation with hemostasis. ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 August 11 edition of Blood. Background: patients with newly diagnosed large B-cell lymphoma and international prognostic index scores greater or equal to 3 have inferior outcomes with rituximab plus cyclophosphamide, doxorubicin, vincristine, and prednisone. Methods: we evaluated efficacy and safety of epcoritamab plus R-CHOP in newly diagnosed LBCL in Arm 1 of the Phase 1b/2 EPCORE NHL2 trial. Results: median age was 64 years, 89% had Ann Arbor stage 4, and 53% had bulky disease. Discussion: this trial was registered at ClinicalTrials.gov. From the 2026 August 18 edition of Blood. Background: deep vein thrombosis is a major cause of morbidity and mortality in critically ill patients. Methods: randomized comparisons with SCDs revealed no systemic biomarker differences, indicating that RCD effects were localized to valve endothelium. Results: DVT clots typically form in the sinus of the deep venous valves and are strongly associated with immobility and reduced venous flow. Discussion: these results extend our previous findings by identifying endothelial shear-dependent signaling in response to OSS as a critical mediator of DVT molecular pathology, and establishing targeted hemodynamic modulation as a potential strategy in a novel model of human critical illness. From the 2026 August 18 edition of Blood. Background: polycythemia vera is characterized by erythrocytosis and increased risk of thrombosis. Methods: IMPRSSION. An ongoing Phase 2A, randomized, open-label study includes patients meeting 2016 World Health Organization criteria for polycythemia vera, requiring greater or equal to 3 phlebotomies within 6 months of screening and greater or equal to 1 phlebotomy within the last 12 weeks. Results: polycythemia vera is characterized by erythrocytosis and increased risk of thrombosis. Discussion. From the 2026 August 20 edition of Blood. Background: chimeric antigen receptor T cells specific for myeloid-associated antigens expressed on the cell surface of acute myeloid leukemia can cause depletion of normal myeloid progenitor cells. Methods: we developed a CAR specific for an HLA*0201 restricted peptide of the myeloid-restricted cathepsin G protein. Results: mechanistically, LCK overexpression in CG1 CAR T cells caused transcriptional modifications characterized by the overexpression of mitochondrial-encoded electron transport chain components that were correlated with increased mitochondrial mass and improved respiratory capacity. Discussion. Based on these data, CG1 CAR T cells hold clinical potential for the treatment of AML. That's it for now for ConferenceHype's coverage of the August 2026 issue of Blood. If anything was missed, tell us which article deserves follow-up. Tag us on X. Add your perspective in the comments, share this review with your clinical team, like the video, and subscribe with notifications turned on for the next journal broadcast.